Men's Health Discussion. Man Up is a nonprofit organization that is designed to educate, equip, and encourage men to live healthy lives mentally, physically, and spiritually. July is recognized as National Minority Mental Health Awareness Month. Today, we're seeking to break the silence in the Black community. We desire to have an open conversation and dialogue about issues and barriers that are surrounding mental health. On our panel today, we have several esteemed guests that will join me in this discussion. On my left is Herb DeBerry. He is the Vice President of Human Resources and Corporate Services, Nashville Electric Service. Mr. Jeff Brown, better known as Mayor Brown, is the Divisional Training Manager at Dollar General. On my far right is Mr. Pete McAdams, Medical Sales, Regional Sales Director. And lastly, we invite in the box to discuss this very important issue, Dr. Thurman Webb. He is a center person consultant, Amani Behavior Health co-owner, and CEO. Again, welcome, gentlemen. We're going to start this conversation with a few ground rules. And the primary ground rules are, there are no ground rules. What we hope to have is really just a casual conversation to really try to learn more about this mental health. And so I'm going to start with a simple question and just simply ask you guys, what do you think about, or how do you define mental health when we hear about it? And so we'll start with Mr. DeBerry.
Thank you, Dr. Moulton. When I think of mental health, a couple of things come to mind. First, I think of mental challenges that result from defects during birth. I think about situations where there are challenges that develop as a result of drug abuse, as a result of an inordinate amount of stress, and also I think of situations where people have some type of physiological imbalance in their body. Those are the things that come to mind.
Sounds good. Mr. Brown.
Sure. From my perspective, when I think about mental health, basically, in a nutshell, it's how we manage the relationship with ourselves and with others. As we think about our emotions, our feelings, our thoughts, how do we manage those, whether it's with ourselves or with those that we're interacting with on a day-to-day basis.
And go to Mr. McAdams.
Yeah, and thanks for having me, Dr. Moulton. I think with mental health, I sometimes wonder why we define it as mental health. We don't define GI health. We don't define bone health, so to speak. We don't define muscle health, right? And if it's all part of the same system, right, so the human body, why do we go out of our way to define mental health, right? Why isn't it just part of health, right? And so I think that's, when I think of it, I think of a lot of what colleagues just talked about, which is, the way I would put it is maybe how we process external stimuli, external factors, in looking at the way we were raised. When stress comes out, when fear comes out, how do we manifest that and what that looks like, from the adrenaline that comes pumping when we get stressed out to being able to pick ourselves up when things are not right. So that's kind of what I'd like to delve into, is more of, do we look at it truly as the same way as a muscle or a bone or a nerve with mental health?
And so we'll end with Dr. Webb giving us his thoughts on mental health, but also just to kind of give us that basis for this discussion. So, Dr. Webb.
Yeah, so mental health is it's a lot of what was already mentioned. Generally, when we define it, we talk about it in terms of our psychological health and our emotional health. And when we start adding cultural variables in there, then there are other things that we add to it also. So it could be your spirituality, which necessarily means it's just something greater than you that factors into your health. And then we talk about our social aspects, which Jeff kind of mentioned, like the relationships, right? Especially for people of color, that factors into your mental health as well. And so it's really about how we process situations both externally and internally. right? How we make meaning of the things that are happening to us or we're causing to happen. And what are the iterations of us, right? We often hear these questions about who am I, but the question is also when am I, right? And so that feeds into our psychological health as well. So there are a lot of nuances in it. Generally, I get nervous when people provide simplistic answers to complex situations.
Yeah.
So generally, complex situations require a complex definition, and mental health is definitely one of those.
Well, it's fascinating when I think about it because, when we talk about it, I always wonder, what it means. And I remember typing up a lot of stuff about it, and I kept saying mental health, mental health.
Yeah.
And then it dawned on me back in the day, we used to call it mental illness.
Yeah.
Or we'd actually put the quote around it and call it crazy.
Call it crazy, yeah.
And so it's great to hear that that we've started looking a little deeper into this. So we're going to move to that next phase and try to be transparent. We're going to try to be vulnerable because we want to really try to get a good understanding of what this is all about. So I'd like to know, and feel free to say no, if you've had, experiences with it, either personally or with your family. So we'll start with Pete. And I'm going to kill the misters and all this stuff.
Yeah,
Let's get down
even
to
informal.
what I really call you guys.
So I think it's a great question, and I want to be as transparent as possible. So the most interaction I've had with a psychiatrist is in premarital counseling, right? And so in premarital counseling, I recommend it for those who are getting ready to get married or as a checkup for those who are married. There was a bit of a stigma there, right? It was at our church, it was recommended, and in full transparency, in the medical sales I work in, I used to sell a drug that called on psychiatrists. So I got to see physicians like Dr. Webb at a more personal level, and it was a recommendation for them. So my wife and I went to premarital counseling and was good, but there were some things that came out that would not have come out if not for going there. He put us in situations that challenged us where, for those of you who have been dating someone and getting ready to get married, they do nothing wrong, right? Like, this is the person I'm going to spend the rest of my life with. And so, but to challenge how you view rearing children, how you view how we divide up the chores in the household, where we go on vacation, how big a house we have. Those are all mental personality characteristics that you have. And so it wasn't always easy. There were a couple of times when we drove away and didn't want to speak to each other, but better have those conversations by someone who in a safe space can provide scenarios that challenge your thinking. And a lot of it came back to where we were raised, right? And I'm sure that's going to continue to come up is the way I was raised. This is the role of the man. This is the role of the woman, right? This is the role of the children. Where those things may start to evolve a little bit because that was the way you were raised, I found out through that counseling, doesn't mean it was right? It was right for you at the time because that's all you knew, right? Yeah. But that's been my biggest experience. I highly recommend it. It was a great psychiatrist that worked with us. So
Now, Pete, I'm going to go biblical. You guys didn't get into the discussion about the man was up here and the woman was down here. I think that's somewhere in the that helps my mental health. But my wife,
the submission part of it all. I think that word was thrown out a couple of times, right? And so,
I think I've submitted. That's great. So I'm going to shift over. Herb, what do you have to say about it? Have you had an experience with that?
Well, I've been in HR a long, long time, and so in the course of that, I interact with employees in situations often, and I think I'll just share this one in particular that seemed to resonate with me. We have situations where I've worked for a number of employers, but all of them are positions that typically are filled by males. And because of that, there's a certain stigma associated with, you got to be strong and got to be tough, and how it's not expected that some of the guys would not be perfect and not be strong. I had one situation where a very experienced employee, very well-respected employee, came in with some challenges, and one of the things, and it kind of gets at the mental health subject, it was one of those times and one of those things that it was important that he felt like it could be handled confidentially. He felt like he needed help, but he didn't want the fact he needed help to be something that became a part of public discussion and spreading the fact it's okay, or that was not a factor. The factor is it's important in my selfhood that it remain discreet and confidential. So we spent some time together, and after talking through that, he recognized that the risk was far greater to go forward and obtain the assistance that he needed than to continue in the path that he was going, which was spiraling down quickly. And so I guess it was kind of one of those experiences for me that I never thought I would see a person in that role come forward and say, I need help, and it's in this area. And the only thing that I guess might have enriched that whole experience is that after it's all over and things are better, in which they did get better and everything did work out well, to be able to share with others that were part of the organization to know that it's okay. It's there for, there assistance available for you. And much like Pete said, it's not a whole lot different than having, if you got an appendix problem, you get that fixed and you go on. Or you got a broken bone, you get that fixed and you go on, and life moves forward, and you're not in a situation where you're forever unable to move forward in your career and be respected and be successful. So that would be the thing that comes to mind right away when you ask that question.
Well, that's well, you hit a lot of areas in there that we're going to circle back to, because I think that's pretty deep, and it really hits the crux of what some of our issues are. And I see Dr. Webb over there shaking his head; he's ready to bite on that one. So let's go ahead and give Jeff a chance to tell us about it. So we're really going to be enlightened now, because this is the big dog on the stage.
I'll be quick so we can get to the big no. So I'm going to piggyback something that Pete mentioned a moment ago as he talked about premarital counseling. So my wife and I are privileged and blessed to be able to work with the marriage ministry at our church, Mount Zion. So as Pete mentioned, premarital counseling is very important. And so we've got the opportunity to help those couples that are early in their relationship, helping them get off to a great start, but then also being able to work with those couples that have been married 30, 40, 50 years as well, that have had issues that have not been uncovered, or have, peeling back the onion, so to speak, as they're dealing with the issues to really get to the core of that. So, having that opportunity to work with couples at each end of the spectrum, either early to, prior to being married, to help them set that strong foundation, and to help them to improve those relationships if they've been married a long time. I use the analogy a lot of times with our car. So we get our car tuned up, we make sure that our car, we rotate the tires, making sure that it's operating well. But we don't spend that same type of intentionality with our relationships and even with ourselves. So a lot of times we'll wait till there's a problem or an issue, as Herb mentioned a moment ago. We'll avoid issues, avoid problems until they become really big, versus dealing with them early or doing that day-to-day maintenance, seeing a counselor even before there are problems or issues so we can avoid those issues. So those are kind of some of the things that come to mind, kind of being proactive versus reactive to get ahead of some of the issues and problems.
Yeah. Oh, man. So that's quite nice. Nice package. Now, Dr. Well, I'm not going to ask you that question. But, because, you guys are hitting some things. So I'm going to kind of shift it just a little bit, because we have here African-American men, black men, who are talking about mental health. So the first part of the question I'm going to ask is simply, do black people actually get mental health or mental illness? I mean, is that a thing? I mean, I thought, historically we've thought about this, something that white people talk about. This ain't us.
Right. So
is that something we should be thinking about? Is it a different dynamic that's going on there?
Yeah, absolutely. Black folks or people of color have been engaging in mental health for a very, very long time, since our inception here in America. But very rarely could you stop picking cotton and say, hey, I need to sit down and talk. All right, that generally ended very terribly, right? But
I need a minute.
Exactly, right? I need a minute, yeah. And so there was a couple of things that that have evolved or come out of that space. Keep in mind that the experience of people of color, in this case specifically African Americans, is it is a traumatic experience. And so we still have aspects of social trauma that exist in the way we process and we seek help. Historically, people of color have gone into Big Mama's kitchen, they've sat down as she's cooked, and they've unloaded on her. And it's because we have this kind of superwoman syndrome that we've cast on the African American female, that when we can't handle it, we lay it at her feet. And so she has been the bearer or the keystone to the health of the community and the mental health of people in that family. But that has also evolved also. There's one other thing that has played a factor into how we see mental health, and that is cultural mistrust. We have not always been able to trust the medical care that comes from mainstream America, in this case, white America. We have not trusted that to be applicable to us in a very real way. And that still shows up today. So we've had a couple of hiccups along the way. Has that trend started to go up? Absolutely. The more people talk about mental health, the more people see people like them in mental health, the more they see people interacting with mental health professionals, the higher the probability that others will do it, right? I am a therapist, and I have a therapist, right? And so I am a therapist, and I work with a lot of people, Actually, I get more clients for my mental performance coaching than I do for therapy, simply by the title.
Now, you got to tell us something about this coaching. Now, we struggling with some of these definitions.
So my industrial and organizational psychologist, that comes out when I talk about coaching, because you generally hear people talk about executive coaching or life coaching, and people are interacting with that. And my therapist background had me create this mental performance coaching space. Mm-hmm. So I do it with a lot of professional athletes and a couple of actors, so forth, so on. However, people are more likely to interact with the coaching than they are the therapy because the stigma still exists. Mm-hmm. So
you saying that if I'm seeing a therapist, I'm going to be on the sofa?
That's what they think.
Right. So is that what y'all think too? What about people?
No, I think it makes a great point. Dr. Webb does, and that words matter, right? Mm-hmm. And so the way we term something, sometimes you mentioned it, was talking about going from the word crazy to mental illness to mental health, right? And I think I wanted to hit back on something that you mentioned with Big Mama, right? In that same vein, the church used to be a place, or was expected to be the place, where you could go to the pastor and expect an answer of some sort, right? But was pastor really trained outside of biblically? Because he just said, trust God, right? Well, what does that look like when I'm bipolar, right? What does that look like when I'm going through a situation that's causing me general anxiety, right? And he did the best he could, right? As did Big Mama, did the best he could. But a lot of times it just left you empty or feeling like for some reason you weren't spiritual enough, right? Or you should just kind of get over this because we didn't have to deal with this. So I think Dr. Webb makes some great points. But yeah, I think the terms we use, because there is a shunning, so to speak, mm-hmm. When you say I'm going to counseling or I'm going to a shrink, the way we say it.
Yeah. So I'm going to come back mm-hmm. to that because it's really interesting. I want to hit on what you were just talking about, going to the Big Mama phenomenon is what I'll call it. Because I know, growing up, I didn't know anyone that actually got counseling, and you really was a stigma on it. So we've laid out all these really sexy definitions,
right?
And I'm just curious. So let's say we go back home mm-hmm. to the real people. Mm-hmm. Is that something that is the family now more accepting of this? Because in my mind, when I first started thinking about this, I always thought of, how am I going to talk to you if I don't know you? I might feel better talking to Jeff. I know Jeff. And that's how I guess we did with Big Mama. So what's the feeling at home? And is there more gain out of talking to you? And you're going to tell us what we're going to get out of talking to you versus talking to Big Mama or, you know, I can easily lay it out on the line to these other guys. So tell me something, guys. Go for it, Jeff.
Sure. Yeah, and you said a lot. So I think in talking to somebody that I'm comfortable with, that I know it's a safe place, right? So even though they might not be trained or how they trained as Dr. Webb, it's somebody that I can be vulnerable with and be open and honest with. So even though they might not be able to technically help me solve the problem, you know, it's somewhere for me to unload, for me to just to share my thoughts and my feelings, right? And I think that's a lot of what happens in therapy that we've gone through is just getting it out there. It's not always that the therapist is giving you answers. It's you helping you to think through your issues yourself. So I think that's what we were getting in that big mama syndrome, is just having that safe place to talk. And I think it's with the stigma being removed, folks are getting more comfortable going to therapy or being vulnerable, being open with our issues, kind of what we've seen with, you know, even Simone Biles this week. You know, being open, it's okay to be okay. I think is why I keep reading that. It's okay to not be okay. Yeah. So that stigma that Dr. Webb talked about is being removed so that we can be honest about what's really wrong. So whether it's a therapist or someone that's in our family, just being honest, being vulnerable to get the help that we need.
So you saying you'll just skip the doctor and you know,
No.
putting words in your
Good
mouth?
point. No. Don't skip the doctor. That's a place to start. But no, we need a professional. We need someone that knows what they're doing.
Right.
No, I'm sorry, I wasn't very clear. So we definitely need the doctor, but initially that's all we had or knew. Once we know better, we do better.
Okay.
So definitely we need the professional. We need the
Okay.
person that knows mental health effectively to help us work through those issues.
Go ahead, Herb.
I'd only add, and I agree with what's been said, I think it's a blend, and it's hard to separate them. You know, I've heard the phrase, and I believe the phrase, most people don't care how much you know unless they know how much you care. And so it's got to be, even if it's a trained professional, it's got to be somebody you have confidence in. You're going to follow a line of action. You got to have confidence if it's a coach or whatever that role is. So while it is important, Pete's right, you know, I think the early ministers may not have been trained for therapy or to deal with a lot of things, but they did have the confidence of those that came to them. So I think you need that. And then you need somebody who is able to guide them, that person in a way that's going to be helpful. So to me, I don't think it should be either or. It seems like it's got to be both. It's got to be a combination of the confidence in that professional that is providing you the assistance that you need to deal with the issues of life that have been a problem for you.
Okay. Well, Pete, you want to fix all this because they kind of lead me astray, I think.
I don't know about fixing it, but I think they both make really great points because it comes down to trust, right? Because if I want to open myself up to the fears that I have and the possible trauma that I had in growing up, and you have to get deep. I'm sure Dr. Webb does about tell me about a time when this happened, right? And it is that trust. So I think the answer lies in how do we establish that trust in Black men other than their wives, their mothers, their sisters saying, I'm going to drag you to this psychiatrist and now go in here and tell them your feelings, right? That typically probably does not work because we as men are more relationship driven, and women are relationship driven as well. But that trust has to be there because you could then take that information, and that's, I guess, if there's a downside to sharing with someone close to you like Big Mama. Well, she knows all of my relatives as well. And what if one day she slips up and she mentions that I can't go to sleep at night because I have post-traumatic stress disorder, right? So how many of our veterans have come back from seeing atrocities and they're trying to process this while also being Black in America, right? And being asked to be the head of the household and not cry and not show fear. I think, role modeling has something to do with it. If you didn't see it growing up, or if your role model was one that said, never cry or never be vulnerable, right, to someone else, it's tough for you to overcome that stigma that you're weak. I think it's one of the things that we saw in pre-gaming this is the sign of a man being strong, right, and what that looks like. Well, if it was defined incorrectly for you, it's hard to overcome that. So I think I gave you more issues than answers.
No. So this was fantastic because it really leads me right back to Dr. Webb. And seriously, the things that you guys said really are insightful, because I think that's where many of us are, that there's that comfort. But what I want to pose to you, Dr. Webb, as well as to respond to some of the things they've said, is this dangerous for us to choose a big mama type or a friend who does not have who's not equipped, I guess, to really handle what they may get?
Yeah.
So and especially if there's that comfort, it may actually push them to tell us more.
Yeah.
And if we aren't equipped, so talk to me a little bit about that.
I can't say that it's dangerous primarily, but there's a concept here. So just because you're productive doesn't mean you're efficient, right?
Got it.
Productivity without efficiency is what leads to burnout. That's what we're doing to Big Mama. Productivity with efficiency leads us to performance. That's generally what you find in someone who's trained to be in this space. Herb, he mentioned earlier, both and. That's what we know as a diunital principle. Mm-hmm. It's not either or, it's both and, which means both can exist in one space. Things that were mentioned here are byproducts of the cultural competency needed to increase the probability for Black men to interact with mental health services, right? So this idea, like this, the cultural competency really drives this thing. What are the nuances in the lived experiences of Black people, specifically Black men, that my therapist may understand that I may not know how to assign words to, right? So I know I'm familiar with the feeling, but I don't have the emotional IQ or the emotional verbiage to assign the word to describe the feeling. These are the things that a culturally competent therapist may help you with, right? So they'll take you through the sequences of how to assign the right words to your feelings so that we could get to the root of the thing. A lot of time, Big Mama is addressing a cough. And we have to remember that there's something creating the cough. Right? But Big Mama has her own diagnosis that needs to be uncovered also. Because remember, we're leaning on her based on a social trauma, which means that the Black experience at best is a reaction to something that's happened to us.
Ooh.
Right? So then that compounds our thought processes as we go through this. So it can be very difficult for an individual like your pastor, right? Because they've created this lane where they say often historically, prayer is enough. Or you just pray about it and it'll fix it, right? Mm-hmm. Or they miss the schizophrenia diagnosis and say that you're filled with demons. Mm-hmm. All right, we ain't here to get into that argument. All I'm saying is there's something else that can complement your prayer. And we could do both of them diunitally, both and, at the same time to treat a real problem. Right? Because a lot of times when we look back through the history of psychology, the cultural mistrust or even the racism will have them diagnosing us with things based on the social construct of racism. So there was a thing called dysesthesia theops or drapetomania.
Oh boy, that's a
right.
word.
So in the event that you felt like you needed to be free, you were diagnosed with drapetomania, mental illness, right? There was also another thing that
just to be free,
just if you wanted to be free, if you said, I think I need to work for myself.
Ooh.
There were other things out there that we know to be like you had a sort of leprosy, and in the event that your skin started to turn white, you were being cured of it, right? But we know that to be vitiligo now. In the racist terms, the only cure for that was to beat them till the skin turns white. Right? So all of these things exist in the American Psychological Association in its inception. So how can we use this standard to diagnose you and I, for one, trying to humanize our experience by not being slaves, but that being looked at as wrong? And then it starts to compound because you had other schools of thought and ideologies based on racism that were impacting the type of care that we got. So it makes sense why I no longer want to interact with that mental health space. right? Because if you've seen Color Purple, what happened? They put her in a mental asylum until she lost her mind for real.
Wow.
So it makes sense, right? Now, I like to say we get in spaces. We've always had it. Why? Because if you've gone to your guardian or jegna or keeper of the tradition or wise or grandmother, that's what we call all of them, right? And you look in the back room and your uncle's in that back room and they set the tray down, but they never came out. And they say, oh, what's wrong with Uncle Bob? And it's, oh, he just touched in the head. They were talking about mental illness. The thing that we celebrate is, guess what? We still took care of our own. So when you start talking about putting us in homes when we get older, statistics show that African Americans or people of color have the lowest rates of doing that. We take care of our own.
And
Why?
of course-
Because there's still a cultural mistrust that exists in that space.
Yeah.
But the tide is changing, right? Because people are equipped to deal with these issues. We're seeing that. We're seeing more males, more African American females interacting in the space, and we're coming with a built-in expertise about the culture and how to apply these principles to mental health.
And let me get that phrase again, because I find that one quite sexy, this drapetomania. So I'm feeling like, Herb, you might be thinking about trying to go through that process.
I'm trying to
Be free.
So keep in mind, there's drapetomania. That was a diagnosis
That-
which caused black people to have the uncontrollable urge to run away from their slave captors.
Isn't that something?
And he has
They gave it a term.
Yes, there was dysesthesia theops, evidenced by disobedience, answering disrespectfully, or refusing to work. The cure for that was to be beat to the skin.
Isn't that something? So I'm going to shift a little bit because I want to get some thoughts on our overall sense of mental health and how much attention it's getting. And so I start with just listing some people, some celebrities, I guess. So Brandon Marshall, Wayne Brady, Ron Artest, aka Meta World Peace.
That's right.
Dwayne The Rock Johnson, Jay-Z, Richard Sherman. And so we have a lot. And if we go to some of our sisters, Naomi Osaka and Simone Biles most recently. And so we have all these celebrities. And so the question I'm going to pose is this just a phase that we're going through, that this is a hot button? Or is it really getting to be, something that we're recognizing and seeing the need to respond to? Particularly, all of these are people of color. So let's kind of delve into that a little bit in terms of what is our perception, because we do have this ongoing fear about information, as you were suggesting, Dr. Webb, in terms of what's coming out. And so I want to hear from you guys. What do you think about this? Is your sense that we're just kind of overselling mental health because it's the buzz of the day, and because celebrities are talking about it? Or is it something that really is finally, the history you've provided certainly suggests that we're finally understanding and needing to respond to it? So I'll pause for you, Herb, to start us off.
Okay, my impression, my perspective is that it's not something that's going to be pushed back in the box. The jack is expanded and it's being identified for what it is, and I think that's a great thing that so that it can be addressed. I mean, this is an issue of pressure of all kinds of impact in the family and the community when mental health is not addressed. And to see that it can be successfully addressed, but it's got to be recognized. We've got to be able to step forward and say, yes, this is an issue, and I'm willing to receive help. And I think it's incredibly important that the individuals that are stepping forward and sharing this have the stature and have the recognition that they do. I mean, Herbert DeBerry overcoming a problem really means nothing, but someone that's in the public venue that has the respect and admiration of many, stepping forward and discussing those kinds of experiences that they've had and the strength of stepping forward and seeing positive results, I think is overdue. I'm thinking that it's not a flash in the pan, but I think it's a transition that we'll see more of going forward. That would be my perspective.
So what about you, Jeff? What do you think about all of the attention we're getting now from mental health? Is this really a thing, or are we overselling?
Yeah, I agree. I agree with her. I think it's definitely more, I think it's getting more acceptable to be open about it. So definitely not a flash in the pan. Definitely not going to be something it's not going to be a flavor of the month. It's definitely going to be something we continue to hear more about. Hopefully folks, as they get more comfortable, get more open, whether they're famous or not. And definitely having the platform makes it easier for those of us that are everyday common folks to relate and to start doing what they're doing. They set the trend, that culture that we heard about earlier. So yeah, I think that I agree completely that we'll see more folks being more open and start to get the help that they need going forward.
So Pete, do you think that that these celebrities doing it, particularly in our African American community, you think that actually is helping us to be more accepting of it? Because it sounds like from what Dr. Webb suggests is that we had some pretty deep-seated stuff going on, and so breaking us out of that, it sounds like it's pretty tough.
Yeah, this might not be a popular answer, but I think no, right? And I actually will push back on what Herb said about if Herb DeBerry does it, I'm just a nobody. No, you're not. You have a circle of influence, friends, family, children, people that know you. I'll tell you, I'll brag on your story about you used to be overweight, right? But you determined, and you have a wonderful testimony of how you changed your diet, you changed your exercise, you changed the way you thought about your body, and you've inspired me, right? I'm sure I've talked to other people who have been inspired by your story much more so than someone who can shoot hoops better than I can, right? Or some celebrity who has resources and availability that the common person does not have, right? So I was thinking about like literacy, right? So LeVar Burton, Reading Rainbow, right? Like he was trying to get people to read more, right? And it influenced me. But you know what really influenced me is when mom and dad sat down with me and they said, boy, it's important for you to not only read, but comprehend what you're reading. And that was day after day after day. And if I have an Uncle Herb who I knew was crazy, but now seems to be in his right mind, I can relate to that because then I can talk to Herb and then Herb can share with me the steps he took so that I either don't go down that same road, or if I do have a similar issue, I can reach out and talk to you because I know you and I trust you. I don't know Simone Biles, right? So what she's done doesn't relate to me very well, other than I just have more questions than answers, and she can't give that to me. But my uncle, my dad, Dr. Webb, yourself, brothers and sisters that I trust or I know, the power of your testimony, right? The power of I went through this so that maybe you don't have to. So I would never shortchange kind of that you're a nobody. Well, I think they're called influencers now. I think it's dangerous at a time to give another human being, and we do it. We like celebrities, right? Because they have either been able to attain some sort of unique success or have some skill set that most of us do not possess, right? So we puff them up, but they're still human beings, right? And they have dark secrets and things. And I think that we just, whether it be social media or just adulation because of sports or your ability to sing and things of that sort, we expect them to be perfect, right? And that's unfair to them as well, right? So to answer your question, I don't like that they brought it to the forefront. Yes, I give them credit for that because they have a larger megaphone than we do. But to look to them for then the answer is very dangerous, very dangerous.
So maybe I'm getting out of this, and Dr. Webb, I'm going to let you respond to this. As I'm hearing all of you speak about it, do you think it's just simply the real impact is maybe they're softening the blow or creating an atmosphere that we can talk about it? Is that what we're seeing? I mean, translate for me, because I I have a hard time following the path.
Yeah, so I think when we look at the celebrities and when they start talking about mental health, awareness is a big deal, right? I have people like in the case of Simone, now everybody's talking about twisties. Nobody knew what twisties was a week ago. Everybody, she's got twisties. Well, what is twisties? That's when her brain is not syncing with her body. There's a disconnect, and she could get really hurt. And that's like what is it? The hips in baseball,
The
like
yips, yep.
like. So now they're making a connection, like, oh, that can happen there too. No, it's not as pronounced in baseball. Why? I can still throw the baseball down there and not get hurt. It won't hit the mark though. Mm-hmm. But I can still throw it down there and be way off the mark. Twisties is something different. When I'm way off the mark, my well-being is in danger because I can land on my neck, or I could crack my back because these things have happened to people who have twisties, right? So what the celebrity does when they start talking about these things is they bring an awareness, and anytime we talk about being an intellectual, we have to celebrate our inquisitiveness. And so that awareness says, well, what is that? Now, like you said, the job is not to be perfect. The job is progress. And that's for the celebrity and that's for the individual, and especially for the African-American male. Because we get trapped in the box of the idea that we have to be perfect, right? Yeah, 10 times harder to get, twice as much, or, no, the idea is progress. So anytime knowledge acquisition happens, and you're right, I don't care if it's from the common person or the person who has a little bit more familiarity from the world. Anytime knowledge acquisition happens and it puts you in a position to make a decision on your behalf, a better decision, you're winning, right? Because we have to learn how to make decisions in our own best interest. You're right. We talk about weight loss all the time. We talk about people stop smoking, all of that. It's easier than you ever imagined and harder than you could ever believe at the same time. That diunital thing again. Why? Because I know what I should do. I ate that hamburger yesterday. I know it's delicious. I just got to stop doing it. It's that easy, right? And it's harder than you ever believe. Why? Because it smells so good. Right? It shows up that way in our mental health also. There are things, people, situations we know we shouldn't interact with because it clouds the way we process information. But because we're so rooted in a habit and we made the decision to have that habit based on a social trigger or trauma, it's hard to get out of that rut sometimes. Sometimes we need someone signaling and encouraging us to take the right step.
All right. So we have a couple questions from Facebook, so thanks for the questions. So the first, I'm going to expand a little bit because this may help us all as we move into this next phase, talking a little bit about treatment and getting closer to treatment, but I also want to swing in a little of the pandemic and the George Floyd effect as well. So we're going to try to just, really squeeze all those in. But here's the first question. There is more of a stigma to seeing a psychiatrist versus a therapist. Mm-hmm. And does a title matter? Now, I want to add a little bit to this. Help us to understand, what are we talking about when we say a psychiatrist versus a psychologist versus a mental health specialist? And now this new term you just threw out, this coach. So help us to understand, what should we be looking for, and what are we talking about here?
Yeah, so psychiatrists usually their intervention plans involve some sort of prescription or medical intervention, right, with regards to pills or prescriptions, things like that. Clinical psychologists, they can make the diagnosis. We do psychological testing, so forth, so on. Therapists, they do diagnosis also, maybe not so much the severe cases that the clinical psychologists would, but they still engage in the therapeutic process in order to meet the needs or remediate some of those issues. And the coach, it's kind of taboo to even say the word in the counseling field right now because everybody's calling themselves a coach. But in the case in which I mean the mental performance coach means anybody can benefit from that process of just going through, like, how do I make myself better? So you may be a functioning individual who just wants to function better, you'll sit down with the mental performance coach in order to go through those things and make it happen. So I've done it with individuals I'm working with a CEO and his team for a high-end retail market right now. I've done it for a couple of financial advisors who've increased their productivity, again, athletes. So everybody who wants to increase their mental performance, generally without all of the downside or deficiencies, they like to engage with coaches. But there are some characteristics that overlap for all.
Gotcha. So it sounds like what he just told me, and you guys helped me, is that if we use a psychiatrist, we can just get a pill and be done. Isn't that what you just
Not
said?
necessarily. That's not what I'm saying. Okay, so no. But they do use medicine as part of their intervention plan to go along with the other therapeutic process. But they have the capability of writing you a prescription, which they would see an individual like Pete here and use that as part of the intervention plan. So the psychiatrist has that capability.
Gotcha. So you guys knew the distinctions between this, because I'm in medicine, and I'll tell you sometimes it gets a little fuzzy in terms of what they do, but that was very helpful in terms of getting a better understanding. Now we're going to shift a little bit. There's another question on Facebook that we're going to talk about a little bit, so I'm going to throw a pandemic question in here, but I want us to jump back into what this question was, and just as you guys, particularly you, Dr. Webb, a chance to start processing this, because I think it's very exciting, especially, or very interesting really, in our community. They're asking a question about professional therapy care versus people seeking drugs and alcohol as a substitute for their care. So the reason I want to go to the pandemic is because as we got into isolation, I think these things started creeping to the forefront. And so we'll talk about that. So we had these big things go on. And I'd be really interested in the workspaces that you guys are in, really, and even with families, knowing what your experience was in terms of how did you see this pandemic, and then the tensions that came about with George Floyd and the events that followed. Did you see differences in your workplace? I know you guys are all working in these levels. I'll start with you, Jeff. What did you see? And the question also is, did you intervene or have to intervene?
Yeah, great question. So I'd say early on in the pandemic, definitely there's a lot of stress, with the unknown, dealing with the unknown, and I work in a retail environment, so we had a broad spectrum of issues, in terms of what folks were dealing with. We do offer counseling to our associates, so we did a lot of education to our associates at all levels to let them know that that counseling is available for free, up to 5 sessions, and we did have a lot of associates or employees that were using that service. Didn't necessarily see it as much in the workplace versus at home. Folks having issues, you talked about self-medication and dealing with, finding ways to deal with that stress. It was really happening more at home versus issues, in the building or at work. We did have a lot of folks that were out with COVID, so they were having to manage that and manage their children having COVID or their family members having COVID. So that stress piece was there. And so again, just the education that services are available and to please use those is really how we tried to approach it.
Okay. Herb, did you have any things that you were directly involved with or had to be involved with because of the work you do?
Well, basically, given the work pretty much like Jeff's organization, and we have to continue to make sure we provide the services that uninterrupted, actually, because whether a person's at home or they're in a physical office, there's the need for power and energy to sustain their activities. And obviously, hospitals and the entire water pumping stations, everybody needs to continue to rely on the ability to deliver the services. As far as from an employee standpoint, I don't think we really experienced very much different from what Jeff said. I mean, there was a big question mark on, what does this mean? We did migrate from all employees reporting to work in a building, basically, to a hybrid of people working at homes. And I think that's kind of maybe what you were alluding to earlier. Don't know what kind of impact that had in the household, but as far as getting the work done and being effective in that role, didn't really see any failure to meet those requirements. We did have some very unfortunate positives, unfortunately, like other organizations that we've dealt with, working through. So yes, it was a very challenging, and that whole subject is very challenging. But I'll have to say that in our organization, I think that employees responded well and effectively, and nothing that really stands out that I think would be different from other organizations that are basically required to be there and support the community.
Pete, I know you have a different kind of work environment, so I'd really be interested in hearing, how did you see it play out?
Yeah, so there was a term, non-essential workers, that came out during the pandemic, and I'm a non-essential worker, right? And what that means is that in what I do, I'm in pharma biotech sales, and so my ability to go in there and sell or market a drug at that point was non-essential, right? So they can research, on their own. Now, from a patient's perspective, so I have a drug for a cancer, a prostate cancer, and there was challenges with those most vulnerable patients coming in to get their treatments, right? So from a personal perspective, didn't affect me as much, but the drugs that helped these patients did. I think one thing that personally I can speak about is I've got 3 children that are both in elementary school. All 3 are in elementary school. The mental fatigue side came from those kids going virtual, right? So now mom and dad are balancing working from home, which is new to me and new to my wife, while also trying to learn this new Zoom technology that's out there, virtual technology, and also get our children to pay attention, right? And what that led to, not specifically in our house, but I think you saw alcohol sales, just skyrocket, right? You saw domestic violence increase, right? Because this 8 hours I used to have away from my family and wife, you would never think that way, but now we're here full time. And now some of the issues that I could get away from or not address because I had this escape called work, I now have to address. And that's what was most disturbing is that this self-medication because of new stressors really led to people's true colors kind of coming out, right? Like our pastor always talks about, what's inside a fruit once you squeeze it, right? Mm-hmm. And that's kind of what was coming out in a negative way. So again, that was kind of my personal side of it, but it gave me a new appreciation for teachers and what they do, because they have to be mental experts it's not just a curriculum of academia that you say, this is why 2 + 2, but little Johnny may have some issue at home or he wasn't fed this morning. What is that mental stress put on him, or he's had to wear the same clothes over and over? Mine's is trying to give my kids, and anyone that has children know this, a stranger almost has more influence to say, you do it this way. Mom and dad, you don't know anything, right? And it can all line up the same. But the stress of getting them to sit in a space and listen to us, it was kind of what made it a little bit different.
So Dr. Webb, I'm going to turn to you on this, but I want to expand it a little bit and still thinking about what Pete just expounded on as well, this substance use, this alcohol. So let's talk about stressors that we're seeing every day. Every day we turn on the news, we're getting the reports of the number of COVID hospitalizations, the number of deaths related to COVID. And then we also are getting the numbers of how many have been vaccinated. And we know how we're doing in the African American community, that we're not as enthusiastic about the vaccine. And so talk to us some about not only what you're experiencing, but even in your circle of other psychologists, what is the sense of how are we handling that? Because we've not done well. We know that we have been the highest percent of deaths being seen so far. So how do you see that in your practice and amongst your colleagues that are dealing with this?
Yeah, so there's definitely been a uptick in individuals who have sought out services, right, due to the pandemic. One of the things that informally that we discuss amongst me and my friends that are in this profession is the technology and the situations that it has created, right? Technology always starts out with this fanfare, which is then followed by this huge concern, and then it balances out. And I like to think that right now we're in the huge concern stage because we just came out of this fanfare stage with technology. Why? Because it was great when we figured out we had information at our fingertips, right? No longer going to the library, card catalog. Look, I'm dating myself, right? The card catalog.
Dewey Decimal System.
Dewey Decimal System. Like, that's null and void, right?
Right.
But also with that is this world of information. Now people are starting to realize that information is not universal, right? So there's information and there's misinformation. If I'm misinformed, then I misunderstand. If I misunderstand, then what happens? I start misspeaking. And in this case, in this society, because everybody has a platform to insert their opinion, then all of a sudden we run into a situation where individuals attach their opinions to their identity, and they start speaking their opinions as if they're facts, and then they get in their feelings, and their feelings are real, but their feelings are not facts. And so this creates this huge storm of information that people have to sift. And kind of like you, Doc, you because of your training, because of your expertise, if you go to the doctor and they walk out of the room and you look at that machine or you read those numbers on those papers, you're very clear on what's happening, right? And so in some situations, you know too much,
Oh, yeah.
right? Just like my wife, right before my mother transitioned, she knew it because she could read the machines because she's a practitioner and she knew all those things were happening. So before I knew, she knew. Why? Because she knew too much in that situation. Now, that's not a bad thing. It's just a different thing. Those things are what's happening now for us as professionals. Like, there's a such thing as too much information for individuals, right? There used to be a time when we didn't understand something in America, we'd work hard to smarten ourselves up. But in this atmosphere, I feel like when we don't know something in America, they dumb it back down till it makes sense to them. Mm-hmm. And then they start talking about vaccinations and what's made up of them. And you're looking at them like, you're not a virologist. What are you talking about? Like, that's how you build a potato head. That's not how you make a vaccine, right? But people speak it with so much confidence, and it's creating a perfect storm of confusion that you generally have to detangle before you actually insert accurate information. And if someone has a politicized the information within them that they've taken in, then it really becomes a problem because, again, it's just another touch point to their identity. So we really got to do work to put things in the proper category, right? Generally people are saying it's not, you've heard this pre-pandemic, oh, it's not the job, it's the people I work with. Right? And like you said, circumstances have created this storm where people's true colors are coming out, and you're like, oh, well, I see why they put my kid out of class. I can't stand them. Right? So when we talk about alcohol and things like that, there's a fine line, the line between too much and addiction. But at the end of the day, when we talk about addiction, people are not addicted to cocaine or heroin or alcohol. They're addicted to escaping. They just use those things to do so.
Oh, boy.
So
I love that, and guys, I hate to say that we're coming close to the end of this session, but I wanted to really give us a chance to talk about as we close out, and I'll give each of you a chance to respond to, because what we're really after is how can we get men, particularly black men, into the offices, and I'm going to save it for Dr. Webb to end that part of it. But also, we need to recognize that I'm sure, as it is in medicine, that we don't have an equal number of people of color who are psychologists and counselors that are available to us. So we're going to have to look for those culturally competent as well. So what I really want to hear from us and think on this too in your response is this divisiveness that we're seeing. We see that people are saying no to the vaccine out loud, but down low getting it. And in the meantime, we're left thinking that they're not getting it, so we're not getting it. And so we have to try to reconcile that as well. So let's talk a little bit about, let us close out, and Pete, we'll start with you in talking about, well, how do we get guys into the door, and how do we break down some of these barriers?
I think it comes back to a lot, and we've been on a few podcasts, or at least this year or so that we've been doing a lot of these talks, is thinking about something bigger than yourself, right? So I need you to be healthy as my father because I need you around in your 80s and 90s to see my grandkids and instill some of the knowledge and wisdom and wealth and resources that if you're dead at 45, you cannot do, right? So if it means you being a little more uncomfortable, right, or doing something outside of the box, that can lead you to being mentally in a place where you can help the family, you as that influencer, it's really where you have to take more of selflessness, right? And so if we're going to treat mental health in the same way as we would with diabetes or any other comorbidities that come with that, I need you at 100% as often as you can be it, and mental health is part of that. So I think when you start to challenge men, especially fathers, to say your kids and your grandkids need you as close to 100%, and this what we've been doing is not working, right? It's the definition of insanity. Keep doing the same thing over and over and expecting something different. We've not been good at this, right? So dad, uncle, brother, will you go get help because I need you to do help? And any father, any brother, any cousin or good friend, if they're worth their weight in salt at all, I think that's the motivation they look for, because most fathers will do anything for their kids. Husband will do anything for their wife, right? And if it means me opening up to someone that looks like me or maybe doesn't look like me, if the end result is wellness, it was worth it.
Absolutely. We'll turn to you, Hurt.
You know, I totally agree with what Pete indicated. In fact, he's kind of converted part of my thought on the impact of the individual. But it is incredibly important, and I think it is, to just summarize my thinking on it, that if we're able to reach out to and impact those individuals that do mean a lot to us, that are family, that are in our community, one by one, I think that's when the tide will really effectively change.
Jeff?
Yeah, again, ditto. There's a term that we often use, the WIFM, or what's in it for me. So that's what comes to mind as I'm listening to their responses. That's how we connect or get folks to change their behavior. I've got to personally identify with the behavior change that needs to happen. It's not just something I'm being asked to do, but there's a benefit to me and everyone else. So definitely when folks get vaccinated, it's impacting the community, those around them. But again, it's impacting me as well. So I'm around for my children and grandchildren, or I'm able to go to work, or even if I don't have children, whatever it is that's important to me, I'm able to do that. So we just have to make that emotional connection to what's important to people to drive that behavior change, for them to see it as important.
So I want you to just remember that you be around for your grandchildren. Pete said you have to be about 80, 90 years old before you can have some. Well, no, I will keep it on par, and I'm going to let Dr. Webb give us some closing thoughts, and certainly on any other along that line, plus other thoughts that you may have that you'd like to share with us.
Yeah, I think the primary question was, how do we get more men in the seats, right? And it's really about quality of life. We would be remiss if we didn't talk about the situations that put men, specifically black men, in survival mode in the first place. Generally, when we're in survival mode, we're thinking about what other things can we impact. because we don't have time to think about the things that are impacting us, right? So we're constantly on offense instead of trying to really become aware of these things and play defense, so we're sticking and moving. There are other social constructs that play into that, because even down to the dating scene, and it still resides. You meet a girl or someone's talking to you, what is the first thing they ask you? What do you do? No, I'm a doctor. Oh, that's a good catch. What do you do? Pharmaceutical sales. Oh, he makes a lot of money. That's a good catch. That's the wrong question. The question is, who are you? Right? And it's not how much money you make. The question is, are you happy? Because if you can answer those questions, then we might actually have a shot. But a lot of times when it comes to men, specifically African-American men, it's all about the benefit. And we subconsciously feel that. And that becomes very unhealthy for us. And we feel not seen because it's all about what I can provide. What do they tell you? You have to be a provider. No, I have to be happy. I have to be healthy. If I can do those things, well, we know when those things are present, it necessarily increases our performance. So we have to change the way we talk about health to men, period. Change the way that I talk about health with Pete. Instead of saying, man, how's work going? Pete, how are you doing? You see that?
Like it.
Now, that level of comfortability, when we establish that comfortableness in our relationship, guess what rides in on the coattails with it? Vulnerability. Now, he stops griping about it, and he describes the problem, and he's looking for insight, because at the end of the day, as a therapist, I'm not giving you the answer. I'm just arranging it so you can decide how the answer you create applies to you. So if we start to share those experiences with each other as men, then we start to raise our emotional intelligence. And now, much like when Kobe passed, it's no big deal when I say, man, I shedded a tear when the helicopter crashed. We can do that about other things too and not be seen as the crybaby, not needing to quote unquote man up. Right? All of these things are detrimental to our mental and emotional health, so we have to change the narrative, change the verbiage around how we talk about those things and start asking about the person and not about the things that they do.
Absolutely. Well, this has really been a wonderful session. I hate that we're at the close of it, but I'll wrap up by saying, one of the things that we like the man up term, as you just suggested, but not for that toxic reason that we used to use it here, is really the actual definition of be strong while doing something difficult. Mm-hmm. And that difficult thing is exactly what you guys have alluded to. And Dr. Webb, you closed us out beautifully in saying, ask us how we're doing. Mm-hmm. There are some things that I've learned. Don't care how much you know, they care about how much you care. And that, I think we're going to close with that and the scripture that we really live by. As iron sharpens iron, so one man sharpens another. So I love the fact that we've had this opportunity. We look to be back next month for our next session. Thank you guys for participating, and we'll close with that.